If you're passionate about healthcare and looking for a profitable, impactful business idea, then starting a home healthcare business might just be your perfect opportunity. Why? Because India's aging population, chronic illness burden, and rising healthcare costs have made home-based medical services more essential than ever. With the right strategy, you can build a business that's both financially sustainable and a lifeline for thousands of families. And the best part? You don't need to be a doctor to build a successful healthcare venture. You just need a solid plan and the right support. In this video, I'll walk you through a step-by-step guide on how to start a home healthcare business in India. Here's what we'll cover: target audience, market research and analysis, marketing and sales strategy, financial planning and profitability, funding and investment options, company incorporation and legal setup, required documents, and finally, how Market Research Universe MRU can help you with expert support. Let's dive in. Stick around with us as Market Research Universe MRU will explain it all for you. This video is part of MRU Navigator for Business Planning. MRU Navigator for Business Planning is a go-to-market platform designed for startup business planning, real-time market trends, forecasts, competitor insights, business niche identification, and opportunity tracking. Through this platform, you'll get free business plan templates across various sectors, real-time market trend tracking, market size and potential analysis, and insights into trending business niches and opportunities. So, what are you waiting for? Sign up for a free account today. Your target audience includes 1. Elderly population age 60 plus, especially in Tier 1 and Tier 2 cities 2. Chronic illness patients, diabetic, cardiac, and dialysis patients 3. Post-operative patients, recovery and rehabilitation support 4. Palliative care seekers, cancer and terminal illness patients 5. NRI families, seeking care for aging parents in India 6. Disabled individuals, needing routine medical or personal care 7. Maternity and childcare, pre-postnatal care, infant monitoring. Understanding their needs is key. Some need 24/7 care, others just need weekly nurse visits or physiotherapy. So, build flexible packages around their requirements. India's home healthcare market is valued at $462.87 billion in 2025 and is growing at a CAGR of 6.9%, 2025 to 2030, a strong indicator of future demand. Key trends: driving the market, telehealth and remote patient monitoring, subscription-based elder care packages, integration with insurance and digital health platforms, shortage of hospital beds and rising treatment costs. Competitor analysis: Portia Medical, Nightingales, and Apollo Home Care are leading players. Differentiation is possible via personalization, affordable pricing, and tech-enabled monitoring. When it comes to marketing, go digital first. Focus on SEO, Google Ads, and health-related content to target people searching for local home care services. Go-to-market plan launch in metros and Tier 2 cities with higher aging populations and NRI density, for example Bengaluru, Pune, Hyderabad, Kochi. Use subscription or on-demand service models for flexibility. Partner with hospitals, clinics, and senior citizen homes. Marketing channels: digital, Google Ads, SEO for local searches, for example, home nurse in Delhi. Offline, pamphlets in hospitals, pharmacies, and gated societies. Referrals: build a doctor and caregiver referral network. Content marketing: blogs, videos on patient care and home recovery. Sales strategy: offer first visit, free or discounted, to onboard customers. Provide customized care packages and 24/7 helpline support. Build trust with certified caregivers, patient feedback loops, and mobile app dashboards. Let's talk money. Initial costs: business registration and compliance. Rupees 50,000 to 1 lakh, staff recruitment and training. Rupees 2 lakh to 5 lakh, medical equipment, BP monitors, beds, etc. Rupees 5 lakh to 10 lakhs. Mobile app, website development. Rupees 1 lakh to 3 lakh, office and admin setup. Rupees 1 lakh to 2 lakh, marketing and advertising. Rupees 1 lakh to 3 lakh, working capital, 6 months. Rupees 5 lakh to 10 lakhs total, approx. Rupees 15 lakhs, 30 lakhs. You can earn through hourly or monthly packages, sample collection, teleconsultations, and more. revenue streams hourly or monthly care services, physiotherapy, pathology sample collection, nursing teleconsultations, and health monitoring packages. Value-added services, diet plans, doctor on-call, medicine delivery, profit margin, gross margin, 40%, 60%, net margin, 15%, 25%, post-scale and optimization. Profits improve with scalability and repeat customers via subscriptions. Focus on subscription models and repeat services for higher margins. Now, how do you fund this business? Options include bootstrapping government schemes like CityBI, CGTM SEPM EdGP for rural or semi-urban setups, angel investors and health tech VCs. Also look for impact investors. Elder care and digital health are trending among them. To operate legally, here's what you'll need. Company registration, PVD Limited or LLP. Trade license and GST registration, professional tax license. Caregiver background checks. Medical liability insurance. Compliance with Clinical Establishment Acts, varies by state. Supporting documents. Promoter ID proofs. Office lease, deed. Staff qualifications, SOPs for service delivery. Feeling overwhelmed? Don't worry, Market Research Universe MRU is here to support you at every stage. We offer real-time market research reports, market feasibility reports, business plan, customized, go-to-market strategies, competitive landscape and pricing intelligence forecast, models and investment benchmarks, investor-ready pitch, decks, business registration.
Every great success story begins with a vision. But what if you had a roadmap to turn that vision into reality? Introducing MRU Navigator for Business Planning, your go-to-market platform for startup business planning, real-time startup market trends, forecasts, competitors, opportunity, and business niche tracking. Imagine this. You're standing at the starting line of your business journey. What if you already knew where the hurdles were? What if you had a strategy before you even took your first step? That's exactly what MRU Navigator for Business Planning does. It gives you a clear, data-driven roadmap to navigate the startup world with confidence. Whether you're an aspiring entrepreneur or a seasoned business owner, MRU Navigator gives you the power of foresight with business plan reports and templates, ready to use, professionally designed to fast-track your startup journey, real-time market trends, dashboard, stay ahead of industry shifts and make informed decisions, competitor and opportunity analysis, identify gaps, analyze competition, and uncover hidden opportunities, business niche tracking, spot emerging trends before they explode into the mainstream. Your success isn't a matter of chance, it's a matter of the right plan. Let MRU Navigator for Business Planning be the launchpad to your entrepreneurial dream. Your startup's journey begins with the right plan. Start with MRU Navigator for Business Planning for real-time market trends, opportunities, and business niche tracking. So what are you waiting for? Sign up your free account today.